We'll go ahead and call the February the 28th, 2011 Public Safety Committee to order. And I'll entertain a motion to approve the minutes of last month's meeting.
So moved.
Have a motion to have a second. And a second. All in favor of the motion say aye.
Aye.
All opposed, motion is carried. If it's okay with the committee, I'd like to, the sheriff had contacted me, and he needs about 5 minutes before we get started of our time, and I'll go ahead and call on the sheriff.
All right, got one other thing I want to give you all. Pledge of amendment.
Sheriff, you got another one? Okay,
We can share.
Okay. All right. That's all right.
Real quick, we got contributions came in from the city of Murfreesboro. Give us $25,000. We want to move that over to account number 336. That's for the fingerprint agreement that we have that goes every year with the city of Murfreesboro. So we want to move it over into that account for the equipment maintenance account.
So moved.
Got a motion to have a second? And a second. Discussion? Call the roll.
Commissioner Gertz?
Yes.
Commissioner Jones?
Yes.
Commissioner McAdoo?
Yes.
Commissioner P?
Yes.
Commissioner Schaefer?
Yes.
Commissioner Young?
Yes.
Commissioner Farley?
Yes.
All right, second thing, glad the mayor's here. I know we've talked about it before in the past, and I just want to bring it up, and you're going to want to get up here.
Before you say.
We had a fire 2 weeks ago out in Milton, and we had terrible communications. And I know since then, when I got back from vacation, y'all done this stuff with the towers, and so I'm bringing it up just for the simple fact we are in a critical stage with our equipment at the sheriff's office, with the towers, with I guess 911. Chris Clark was trying to get another ambulance out on the scene. We had a firefighter down out there, and he could not get another ambulance out there. You, I believe, were also out there. You were working the fire, correct? Mm-hmm. And luckily, I was able out there. I had my handheld radio, and I was able to get through to the sheriff's office, which was able to call over to the ambulance service to get us another ambulance out there. My opinion on this is a critical stage. We're mission critical. We have 18 months from now, we'll be dead in the water. We won't be able to have communication at the sheriff's office. This equipment is so old. The mayor does have emergency purchasing powers under the Private Act. I've researched that here lately, and I'm just bringing it back up to you. I've got the Lascassas Fire Department that I told them that we were talking about it that day, and they believe that this is a great big problem. Kittrell believes it's a huge problem. So I just wanted to bring it back to y'all's attention, and we've got to do something. We're going to lose an officer. We're going to lose a firefighter. I'll fold the flag, but I want to know which one wants to hand it when someone gets killed, because this is how critical it is. We've got problems with communication in this county.
I know we had the grant that we received, the $400,000 for the infrastructure, and I think part of the plan is I think the county's put in how much on this?
Well, on that piece, 100,000, but we've already got another 315 we're committed to, so that's 400. We hadn't allocated that and appropriated that 100,000, right. But you're going to need to.
And then the 911 board is they have not voted on it yet, but I think knowing those individuals, how it was going to help each municipality in the county, I'm pretty sure that the 911 board would be willing to go along and help us.
And I'm going to be willing to take it with what I found out today, talking to a few people about going back to the 911 board. I've asked for money just for our dispatch, but also asking for the towers, asking, I believe it was for $1 million, is going to ask for the 911 board. I mean, I'll be willing to share it, take it to them, and I know we probably can get the Eagleville mayor on board. He's on the committee, so with the Smyrna and those guys. But I just wanted really and truly to come up here and tell you we are mission critical. You've heard me talk about the parts, getting them off of eBay, out of other countries, stuff catching on fire. Well, now with this, we had, and I believe back here in the crowd is the firefighter that was down, that we did have to send to the hospital. So, you know, kind of put a face with it and just let you know that we've got to do something.
Communications is,
Well, we've been working on this since 2009, and what you're telling us, we need to move faster.
Yeah, it's kind of like, do something even if it's wrong. We've got to do
Yeah,
something.
well, we've got
You know, it's.
Tiger Hill Towers, we're gonna take bids on that. We're drawing the specs for the microwave equipment to go on them, so, we just gotta get together the rest of the money, but we're moving forward.
So, but I believe that this is.
We have a
mission
plan
critical.
that I think will work.
You're kind of preaching to the choir.
Yeah.
They've heard
My
this.
end of it.
We even discussed a mobile repeater for, I know that's one of your ideas. You
Well,
brought
I'm
up.
skeptical of how well the system will work because in the Milton area and the Kitchell area, we've got dead zones, and we've had dead zones since in the 90s when I first started firefighting, and I'm sick of it. And I've been in the same place you've been, not with a firefighter down, but I've had a house on fire and I'm trying to get in and call for backup and I can't get it. And it's frustrating and it's dangerous. And what I've asked is we get these repeaters in and there's still dead zones in there, that we get mobile units for those areas that have dead zones so we can still communicate. We've got to do something there. And we are on track with this tower system, and that's one reason I voted for the tower system, even though I'm skeptical that they're gonna cover my area over
Or
there.
we're gonna put one tower right in your area,
That's good, right on top of,
up there by the CUD water towers where we're proposing to do this, and CUD is basically said that they think that'll work.
yeah. Actually, Mayor.
That'll be the next one.
Mayor Burgess and I went for Mayor Burgess to one of the 911 meetings because he was not able to attend. And I went as chairman of public safety to start asking 911 board for the money. And the Mayor Burgess has been there and spoke of it as well. So we understand it and we think it's, we agree with you, it's in dire need and we need to get something done. And
I just wanted to bring it back to you because we had that problem.
well, while we're on that, let me throw one other thing out there, and we've discussed this in the past, and I wanna know where this is on the situation. We've talked about having a joint dispatch with our ambulance service and with ESO. Are we looking at that seriously, or?
Yes, seriously, we are.
I mean,
there's a 911 board has voted, and I think is contracted with someone now doing a study on some
Well,
things.
before we go, and
We're
Yeah.
in the middle
before
of
we,
the study.
we go out and buy you a unit and him a unit and the fire people a unit, I wanna look at what we do on consolidating and saving some money here.
That's being done right now.
And that,
Plans
that
to,
goes back in the plans, and I know y'all got other stuff, and I'll show you those plans at the next meeting, because, yeah, I appreciate you letting me get in here with the amendment and to bring this up, but in the new plans for the new building, we've either decided to add the 15 stations, either for us to grow or us to consolidate, either one. So it's been talked about, thought about. The mayor, I think, has seen a copy of the plans. So, you know, whichever way we decide to go, we can go.
Well, there's not a problem with you or with the director of the ambulance service having a consolidated,
No, I think
Dispatch,
we've
is
already,
that right?
the mayor and I, we've all talked, so. We're ready to rock and roll. I mean, we've already laid the plans out, if it should roll that way, or,
Matter of fact, you two will be seeing it in budget, coming from Property Management Committee.
yeah, we saw it on property management that was presented.
I really think he should show those plans to public safety, ought to get
Yeah.
a sort of a recommendation from both property management and public
no, I
safety.
plan on, my meeting to come up here, I appreciate it, that's why I didn't bring it. I just wanna take a few minutes of your time
Yeah.
today. You've got plenty to do the rest of the night, so if you're done with me, I will adjourn and let you get done with that, but I appreciate you listening, and appreciate your thoughts on it, and, just, we need to do something.
Appreciate it.
Thank you.
All right. Next is the Sheriff Department, the Emergency Management Agency report and budget. I think,
Roger, I should have laid it in the same hand.
got your report on your desk.
Well, while we're asking, Roger, I didn't see you behind him, but I want to hear from your corner there.
Well, I think you're exactly right, and to speak on your concern, one of the main parts of the new communication system is microwave simulcast, which means regardless of where they are, that signal is going to be bounced around and get back in milliseconds. So there won't be the cliffs making a dead space. And I think it's going to improve, according to all the experts, that will improve our coverage quite a bit. But right now, we all know the system was built to be a mobile radio, not a handheld radio system. And even though it's hard on us sometimes, we need to make sure we stay focused and have our hands on a mobile radio to make sure we can get back when we need to get help. Handhelds will fail a lot of times in a lot of places. You're exactly right. And we need to be cognizant of that and make sure that we do use that mobile radio. Yes, mobiles will also fail in some areas because there are some real dead areas. There's a few of them out there. But the simulcast system should cover that. And my hopes are, from everything I've seen, we will not have those dead areas, and I will feel a lot better on the safety of our responders. I, too, am worried about that, and it has been something that's been a problem for years.
Well, my main question was, will you support the communications being consolidated?
Yes.
Thank you. That's all I wanted to know. Thank you, Roger.
All right. First of all, I think, is this your first public safety committee?
Yes,
back?
sir.
And glad to have you back.
Thank you. And I'll try not to slur too much.
Don't worry about that.
I've talked a lot today.
You don't worry about that. Go right ahead.
First thing is my report, and it's pretty atypical. There's been quite a few, something new that the National Weather Service and TEMA has started, and the Corps of Engineers is having conference calls and preparation and notifications of weather and stuff, and we've are signed up on that and take part of it, and it's been very helpful in planning. I was glad to know that we were going to have a rough ride this morning, but it went on over without any major problems here in Rutherford County, just like the one last week. So hopefully it'll stay that way. I don't know if you know or not, but I think it was Franklin County, they had a touchdown.
Oh, they did?
We got a team of folks and all down there working. I don't have an update on how it is yet.
So there was rotation. You can put your report.
Yeah, is there any questions on his report? If there's none, I entertain a motion.
So moved.
Got a motion, do I have a second? And a second. All in favor of the motion, say aye. Aye. All opposed, motion is carried.
Okay, on my budget, number one, I agree with the mayor's and his recommendations of what he and I went through this morning. I will tell you there's three things that changed on it. Other than that, it's the same budget as this fiscal year. One was on 334, I increased it by $500 because of additional generators for services.
Okay.
And I guess it's just two now. And 709, $5,000 for OIT and updated wireless system and software for computer system operating systems. That they said we needed to update. Every one of our computers has a different operating system, and they're pretty outdated. So he said we needed to do that. And that's the only changes. And like always, I don't know how much money will be carried over on the Homeland Security until June 1st because we're still spending that. So I won't know until June 1st.
Anybody have any questions on his budget?
Yes, what about gasoline?
I'm worried about gasoline, but I kept it the same. And I did that on the fact that I don't know how much response and all we'll have, and I know that the county will have a line that there will be monies in there for gas, and if it comes to it, then we'll come and ask. But right now, I wanted to stay and see if we can't make it work.
Anybody else?
Yeah,
Go ahead.
okay. I'm just wondering, are we getting increases in Social Security, Medicare, and that type of thing? I just noticed it looks like that they were going up some, and maybe not
Well, you notice
well
this,
on the Medicare things, but I guess it's not much. So.
well, it's a little bit, there's a step increase for the assistant in line item 103, and associated with that will be the attendant Social Security and Medicare increases.
And so for this year, the communications, you haven't
That
used
28?
that.
Well,
Yeah,
that's.
does that seem pretty
No,
good?
I have a
for-
$17,000 bill that comes in. I think it actually comes in the 1st of May or the latter part of April that's due by June, and that's just where it hits all the time.
Well, what I guess I'm getting at is there going to be somewhere that you might be able to get some gasoline money if you need it?
Well,
We'll definitely look at
well,
that.
first we'll try it within here, but, you know, every year we put a little account out there that has, I think we put either $50,000 or $100,000 in that everybody draws down out of, so if we need to.
You know, this year when it's $4 plus, you know.
I'll remind you of this, and some may know, but since my tenure here, I have never gone and asked for additional money out of unappropriated funds. Never done it. I've always been able to do it within, I didn't do something that I had planned on doing, but I tried to do it within the monies that you all allocate me.
Anybody else? Is there a recommendation?
Motion to approve the recommended budget.
Got a motion to approve the recommended budget. Is there a second?
Second.
And we got a second. Any discussion? All in favor of the motion, say aye. All opposed? Motion is carried. Is that it?
That's it.
Thank you, brother.
Thank you very much.
All right. Juvenile detention report and budget.
Good evening.
How you doing?
Great. In front of you, you have my monthly report for January. I don't believe that there's anything terribly unusual in it, but I will be happy to answer any questions that you have. We're still waiting on Coffee County's January billing, but it's technically not due till a little later this week, so we don't expect to have any problems out of that.
If there's any questions on the report, I'll entertain a motion.
Motion to approve.
Got a motion to have a second?
Second.
And a second. All in favor of the motion, say aye. All opposed, motion is carried.
Okay, you also have our 11-12 fiscal budget worksheet in front of you. The one thing I want to point out right off the bat is that on the second page, the increase of should be 2,451. I didn't catch that until
I'm sorry, would you?
2,451. We had made some minor.
Second page, where she had the summary, the increase
Oh.
of, she's marked through that 4723, the very, very last line item.
Good one, the right side.
Okay, what's that?
We had made some minor changes, and I just didn't correct that on the second page.
And what is your increase?
$2,451. And those monies are spread out on 7 different line items. We've had some reductions along the way as well, so I'll answer any questions that you have.
That's not any additional employees either, is it?
No, it's not.
Anybody have any questions?
Yeah, just help me out on what it was about 2 years ago, and that we had the trial thing with the nurses, the nurse coming in, wasn't it? And last year, it was permanent, and I don't know what it would be under here, but is it still holding its own?
That's in line item 340, and we're recommending an increase there because we think we need some additional hours to support the needs of the medical needs. And we are engaged even now in the midst of a substantially difficult lawsuit. So we think this would be some sort of preventative measure to help us keep in place the proper oversight of the review and needs of these young people with respect to their medical conditions.
Okay, then let's go back to your report for a second, and just looking at the numbers, and they've been down for several months over what they've been, and that look, and it's just off the top of my head, that's lower than it's been in the past. Isn't it usually up in around the 80 mark or something as a standard?
As far as the average population?
Population, yeah.
Actually, usually between 25 and 30. Keep in mind, over the years, this is something that we talk about a lot. The juvenile population ebbs and tides. Everybody wants to know, what is it? Is it this program or that program? And it's really just, there is no one thing. Some days we have, lots of officers bringing in lots of kids, and some days we don't. The January numbers are low because of the snow days that we had in school. The kids didn't get out, they didn't go to school, and they didn't leave home and commit any crimes. It was too cold. So what I tried to explain to the mayor, and I think he agrees with me, is that the increase on the medical service hours is not and should not be based on population. We need to be as focused on making sure that we have healthy kids on the front side of it, not trying to make it right after something has been discovered. So that if your question is why are we increasing medical services if the last couple of months we have a decrease in population, it's not really population or numbers based.
Well,
One young person with some severe needs can easily take up quite a bit of the nurses are only there right now about 16, 17 hours a week. So it's pretty minimal.
and so that you're gonna be able, with this increase, to get 6 more hours per week, right? And
Yes.
it's gonna be able, so that basically you'll be able to cover round the clock, and when I say that, is like a third shift hour or something, you'll have somebody there for 2 hours of that, or?
Right now,
I don't know, dude. What I'm getting at is they take medication at different
yes,
times of their day.
Right now we have 2 med passes. This isn't going to add a third med pass. We still have JDC employees that administer anything beyond those 2 med passes because kids are on different med pass schedules just because. This doesn't add an additional med pass. What this does is allow them to sit down and spend more time on each child and what their particular situation may be. If we have, it allows them to do more follow-up and not just come in, pass meds, document it, and leave. They get to actually do more nursing.
By next year, I'll digest it. Yes, chew on that for a while.
Lynn, as far as lawsuits and some of the inmates that do have health problems, now I'm going to make the assumption, since the way our contract, the way I understand it, reads with these other counties, that at any time we can say, hey, come get this person. And I'm assuming that anybody that's got some high-cost medical needs, we would do that with. Is that correct?
Yes.
And the same thing is any of these lawsuits pertaining to people that are out of county?
Well, we've only have the one lawsuit of any consequence regarding this, and this is an out-of-county person. And we have,
As soon as we were able to discharge him from our care, we did, but his situation happened very quickly, and quite frankly, it was something that we believe that he had when he walked through the door.
Or you give them a medical examination as soon as you
That's
can,
the,
which is
that's the
usually
debate that the lawyers are having right now is,
how soon that was done.
no, it's whether or not it was,
Well, do we need to,
Or we need
We-
to not
we
talk
don't really
about
need to
talk
this.
about the-
we're, we know it's a complicated, difficult situation. What
I mean-
what we're proposing is so that we can be sure that we can be more proactive on the front end when these patients, when these inmates come in there, these juveniles. So, but with respect to the county of origin, we are across involving them in the lawsuit, trying to push back the responsibility to them. Of course, they're pushing back and saying no. So, but short answer is we're in the middle of something that's fairly serious, and it'll take us a while to get through it.
Commissioner, didn't mean to cut you off there, I just,
Well, I understand. That's
You know-
fine. That's fine. I just want to ensure that, we do have these contracts in place and we can pull the plug when we need to.
yes,
So I wanna make sure we're
absolutely,
doing that.
and we always do that as soon as we can when the need arises.
Okay, thank you.
anybody else got any questions on her budget?
And you are in agreement, Mayor?
Yes, we're in agreement now, yes, sir.
Is there a motion or recommendation?
Make a motion to approve juvenile's budget for next year.
All right, we got a motion, is there a second?
I'll second.
And a second. Discussion? All in favor of the motion, say aye. Aye. All opposed? Motion carried.
I'd like to. I'll send one to budget.
Oh, okay. All right, thank
All right, appreciate it. Ambulance services report and
Few
budget.
things in this document, I'll tell you.
How you doing, Mike? Good, how are you? Doing good. See, you brought you 3 bodyguards with you. Yeah, do the report first, you found.
Thank you, sir.
Thank you, sir. Found it. Save you some. Is that right, Linda? Yep.
We made 1,845 calls last month. Average response time 7.9 minutes. 33 coroner's calls. There were 10 requests for autopsies. We billed $1,139,607, collected $494,638. It puts us year-to-date $3,306,706, and a projection of $5,668,639.
Excuse me a second, this is a question that occurred to me. Who actually does the autopsies that this county performs?
The medical examiner in Nashville.
Okay.
We had insurance write-offs of $376,994. Collection agency write-offs $73,918, and county related $2,453. The table at the bottom of the page is the cost per mile and the mileage on the vehicles. Drove a total of 37,048 miles. And a total of 454 out-of-zone calls.
Mike, while you were there, sort of point out to them the mileage on some of those units that we have there that you're needing to seriously consider replacing.
About 175,000 miles on unit number 36, and 157,000 miles on ambulance number 39.
What stations are they at?
39 is a transport vehicle, and 36 is a backup ambulance.
Wasn't there a state law or something?
175.
175? That way they gotta be recertified even more than they have to.
Even more than they have to normally, but yeah, almost about once a month, to be honest.
Does that cost us, is there a fee or?
It doesn't cost us because our mechanics have been certified to be able to do that.
What can they go up to? I know you've said this before.
We feel like that they probably ought to be thinking about doing something with them at 175, just because they, that's a lot of miles, and particularly the type of miles they have. When we get a new ambulance, it bills miles quickly because it's an it's an on-duty ambulance. And then as they rotate through the fleet, they become a backup ambulance and they begin to collect less and less miles. So usually they're about anywhere from 5 to 7 years old before they get that kind of mileage on them. But you can tell putting, basically 40,000 miles a month on the fleet.
That's like those, what was it there, 62, 63, 64, 65. Those are the last 4 we bought, and they've already got 15,000 miles on roughly.
If you'll just sort of take that assumption that we're running 37,000 miles a month or 40 a month, that's 480,000 miles. That's 2 ambulances per year that we're using up.
Right.
You sort of need to be acquiring 2 per year on the average to sort of stay even.
Wasn't there something too where the ambulances now have to have a dually versus a single wheel on the, so that's gonna cost y'all more too because of the law, not because of something you're trying to do, but just because the.
It depends on the size of the box. We could go to a smaller box, but really
That don't work.
I think one of the best things we did was when we went to the bigger box.
Yeah, medics will tell you that.
Yeah. It gives them more room back there to perform, and it also gives them room back there to
work.
To work. I mean, if they're not working in good area, it's gonna be rough on somebody.
One of the things I'd like to point out to you on the in-service and training is number 4. We have a new software, actually 2 new softwares, to be honest with you. MARS is our new billing service, and it interacts with this ESO, which is actually a patient care reporting form that the medics fill out. We went live with that in February the 1st. And Randy and Stoney and some others, some of the station managers, conducted 22 different in-services for us to train all of our medics to be able to do that. And all of them were trained, all of them had completed it. And then those people have been on call 24 hours a day for questions. And I think the questions are slowing down now, but in the beginning, there was some late night calls.
I can't see Randy working 24 hours a day.
He could do it from home.
Oh, is that?
3 o'clock in the morning.
Our new software is web-based, so that makes it kind of handy for things like that. We have the next sheet is a new sheet for you, and it replaces one of the other ones. I think this gives you a better picture of how many calls each ambulance makes and where it makes the calls. In other words, station number 1 is Salem Road. They made 144 calls in their area. They made 16 calls in Zone 2, which is Burton Street. And they made 4 calls in Zone 3, which is Blackman, and so forth like that. They made a total of 191 calls with a response time of 7.0 minutes. And you can see each one. The one that was that was causing some problems with our numbers, if you'll recall, was the Manchester Road. They're in Zone 12. They made 112 calls into Zone 4, which is MTSU zone, because they go up to Publix and stand by in the parking lot at Publix at the corner of Manchester Highway and Rutherford Boulevard. And from that area, you can see where they made 3 calls into Zone 2, which is Burton Street zone, and they made 24 calls in their own zone.
So you're telling me you need the next ambulance station out in the Kittrell-Les-Cassett area?
Actually, they do need an ambulance out there. There's not any doubt about that, because MTSU is the biggest zone we have, geographically and everything. I think, though, that if you were to pin me down and say, if you need a new ambulance, where would you put it? I'd say that we need a support team, a team that can go wherever they need to go. Instead of bringing Manchester Road in, if MTSU is busy, then you just send that support team into the MTSU zone. We have one support team right now, but we're kind of being forced to use that to cover FMLA and sickness and those kind of things. They get to act as a support team very, very rarely.
Kind of a roving type unit that would cover your backups. And how many calls a day do y'all normally have?
Well, typically about 60.
60, and normally out of district calls, or out of zone calls.
That's probably out of the 60, there's between 12 and 15 out of zone.
Yeah. So roughly, what, 20% are out of zone?
And then we kept the page that shows the calls divided by commissioner's districts. And our transport team, the critical transport team, primarily gets its calls from Middle Tennessee Medical Center and Stonecrest. And they made a total of 73 911 calls for a total of 123 calls. And the next page is the district calls by year to date.
I think just cut your district out and let it float off in the Gulf of Mexico or something. We could save this county a lot of money.
They bring in the money.
Commissioner Young's district is the one causing all the problems. It's causing
1,500.
causing problems with Commissioner P's zone and with Commissioner Jenkins' zone.
Well, I like this page you put in here too, where it shows all the zones, so I can see how many out of zone calls my actual areas versus, somewhere else.
2 or 3 thank you notes there. There's 489 FMLA sick hours and 261 sick hours and 1,905 vacation hours.
Any questions? No questions, I entertain a motion on the report.
Motion to approve.
Got a motion, got a second.
Second.
And a second. All in favor of the motion, say aye.
Aye.
All opposed, motion carries. And we got a budget amendment.
We have a budget amendment. Last year, after the budget was set, we realized that we had one of our employees in the office was supposed to have gotten a step raise, and she didn't get one in the budget, so it wasn't budgeted. And the finance office feels like it's probably time that we go ahead and address this. So it's moving money from paraprofessional account into the accountant's bookkeeper account in the amount of $1,102. Motion to approve.
Got a motion, do we have a second?
Second.
Got a second, all right, discussion. Call the roll.
Commissioner Gooch?
Yes.
Commissioner Jones?
Yes.
Commissioner McAdoo?
Yes.
Commissioner P?
Yes.
Commissioner Schaefer?
Yes.
Commissioner Young?
Yes.
Commissioner Farley?
Yes. I'll pass some film for you, Mike.
There's one correction I need you to make before we talk about this. On line item 307, the requested amount is 118,840. If you would scratch through that and insert $100,000. Understand that?
Does that affect the total or is the total correct?
No, it will affect the total. 307.
100.
Does that keep your data line intact, or is that taking that away?
No, it keeps it intact. You want to go through this line item by line item? You want to go through it on the...
I just, if they got any questions about a line item or whatever, because it appears that, it's what, there is an increase a little bit. Just want to know what the increases are.
Yeah. First of all, under paraprofessionals, we're requesting to upgrade 2 EMT positions to paramedic 1 positions. The 2 people that are in those EMT positions are the 2 people that are currently in paramedic school, and they're the ones that received the scholarships this year. And that amounts to $1,407.10. Line item 166, custodial personnel, we're asking to do away with that one and to replace it with 167, maintenance personnel. We're basically just upgrading that position because the person that we have in that position is doing maintenance work, and Sonia has been involved in this, and we've rewritten his job description, and we just need to do that. The part-time personnel is an increase. That's just based on the expenditures. The overtime pay is an increase. It was based on expenditures, but we have also asked to include $11,500. Some of you know that we used to have quarterly in-services where all personnel attended, and we haven't done that in several years. And I feel like we need to have at least one for every shift, so that we can talk to everybody. Because as it is right now, I can't talk to all of them at one time. I miss that. I think sometimes we need that. May not need it next year, but at least every once in a while we need to have one of those.
You wouldn't happen to have a breakdown of what the SORT team's cost is for the ambulance service, do you? Because I know I emailed you concerning,
You call me.
Called you, I'm sorry, and we had talked about it. I'd just like to see what that cost is for the county, their, insurance, heat, everything, because like I told you, my district is 100% inside the city, and I represent the city, my constituents, and the special ops team provides my constituent service through mutual aid, because the Murfreesboro Fire Department provides on a first due basis those services. And I know I talked to you about it, and I'm for the SORT team. We needed them today. We couldn't have done it without them. I just want to make sure the funding mechanism is the right way to be fair to my constituents, because it's not fair for, I know we said 8 cents of the property tax comes if that's correct, comes out of, to pay for the ambulance service. But if you're using my constituents' property tax to pay for the sort team, it's not fair to them.
Well, right now, the fees that the ambulance service is generating, what's that?
But
You probably have to ask the mayor when it comes to those cents on the tax rate. I don't know.
But Matthew, there are a lot of other issues that we need to discuss with this. The sort team within this budget is the right place for it to be. And they're providing services for the city, as you say, mutual aid.
that does not count first. If you
Let me
look at
say
the.
what, and I have not been able to find any documentation or any law or regulation that says they have to be funded out of situs-based taxes.
I agree, but the problem is they're supplementing the county fire department.
And we're also supplementing the city of Murfreesboro by picking up solid waste from them at no charge. So we really need to look at the whole picture.
Well, they pay county taxes for solid
Well,
waste services in the
You
city.
need to come by and we'll have a discussion about this, but I
Well,
don't think that we should be trying to, at this point, determine that we're going to strip this out and fund this sort team out of situs-based taxes.
Well, it's not necessarily situs-based. If the county residents want to pay for it, then maybe we need to add property tax to the unincorporated areas. They're going to have to eventually through a fire tax.
Well, not necessarily.
The
The
budget's
last thing we
trimmed.
want to do is put in another tax on our citizens out there.
But I don't want my citizens overtaxed.
Well,
And
I
I'm
believe
gonna
all of
fight
these,
for them.
the citizens, you're representing all the citizens in the whole county, I believe.
But I
Not
represent.
just the city of Murfreesboro.
But I have to represent District 16, you know.
Well,
Percentage-wise, the ambulance does a lot more work in your district than anybody
Anybody
else.
else. But
the sort team
But
does-
we're paying the same amount of money, even though.
Absolutely, you're
But
getting
Everybody's
it.
covered
mine
by
are
the
paying,
fire, so-
paying high ambulance charges to do that.
Well, I would say most of your people are being reimbursed by either Medicare or Medicaid.
Well, they might or might not
So-
be. I'm not gonna be skeptical on that. I just don't think it's fair for my constituents to
I
pay
think
a
it's
higher.
perfectly fair, and I'm willing to debate that anytime.
Well, I will debate it,
Well, why don't we do-
100%, but we're supplementing the county fire service by the sort team going to every structure fire, every motor vehicle accident. That's my constituents paying for fire protection. That's wrong.
I don't think that's wrong. I think there are other attendant circumstances,
Well,
Matt,
that's-
that you need to look at the whole
Well, I
picture.
could have an extra ambulance in my
Well, I think we
district.
need to
Why
get,
don't we do
I could
this?
have an extra ambulance.
I'm gonna call this to order. What you need to do is get with Mayor Burgess and y'all meet and discuss
I'd like-
this. We're actually going over the ambulance service budget right now.
It's
You know, you're debating fire, wrecks, and things like that.
Well, then they don't need to go on car fires or structure fires or
I'd like for
car
you to get
wrecks.
your chief of police and your chief of your fire department to tell us specifically, they don't want us ever to be used in your areas.
It's not that they're not to be used area. That's mutual aid. The city provides mutual aid to the county.
Thank goodness we're working very well together.
But I don't
Excellent
want to be
relationship.
my citizens to be taxed to provide basic service to the unincorporated areas.
Point
It's
well
not fair.
taken.
Well, I
We
think
just-
corporate areas doesn't get all the sales tax that we come into the city and pay our groceries and things like that. That all goes to the city, so there's a lot of trade-offs there, Mr. Young.
Yeah, and my constituents don't want to be forcibly annexed into the city, but we still have to provide county services.
Well, I'm in the city and I got a city district and you probably need to discuss it with Mayor Burgess because it is a lot of trade-off. A lot,
I believe in trade-off, but it has to be
a lot.
shared revenue for that to work, and we're not sharing that revenue to the city.
Well, the city of Murfreesboro and Rutherford County have worked together on numerous issues throughout the years. And we've built roads together, we've built buildings together, we've worked together on emergency calls. We've done numerous things together, and
We just don't need to duplicate services in the same areas. If we're providing it, if it's getting provided to me as a city resident, I don't want it duplicated by the county, and I have to pay for it twice. It's not fair to me. It's not fair to my constituents.
Well,
It's not fair to Mr. McAdoo's constituents to have to pay for it twice.
Mine sort of love it because they get double indemnity. And I have had calls like that, and I tell them specifically, you call the city and they can't respond, call the county. And the county usually responds, so they like double indemnity in my district.
Go ahead, Mike.
There's some of these line items, Social Security and state retirement and employer Medicare, that's just done by a formula provided to us by the Finance Department. So, I don't know if there's any increases or not, but I do know there's increases on here. Maintenance and repair service vehicles, we've increased that a little bit, but I want you to understand that I think Mr. Farley is going to ask you in a few minutes to provide a budget for the rescue trucks, and that figure is based on him having a budget for the maintenance of the rescue trucks. The medical and dental services is actually a salary that we pay Dr. Russ Galloway for being medical director of the ambulance service. We haven't given him any increase in several years. And as you can tell, we don't pay him very much anyway. We'd like to increase that 5%. Postal charges and printing stationery and forms have gone down because we expect less charges on those because of the new way that we're billing. Travel has gone up a little bit, but that's going to be reimbursed completely by 911. We received $25,000? All received it too.
On the
all the PSAPs received.
Yeah, on dispatch
$25,000
training.
to $30,000 last year and this year, but it can only be used specifically for dispatcher training,
Right.
which involves some travel. Other contracted services, that's a huge increase. That's where we're going to be paying the billing company out of this line item. That was the last month, you recall, you had a budget amendment to create that line item and to put $110,000 in. Data processing supplies has gone up. We requested to put all-in-one printers in stations that will help us to be more effective in our billing practices, because as it is right now, they collect face sheets whenever they take a patient to the emergency room. Those face sheets have to come to our accounts receivable people. And right now what they're doing is driving them down here. What we'd like to do is either scan them and send them a digital copy and shred it right there on the premises, or for those that don't feel comfortable doing that, we let them fax it to us. And Brian Robertson has approved that. Gasoline, I put a number in there. That's just a guess. I don't know what to tell you. I don't think any of us know. Utilities, same thing. We do know that they've gone up, but we don't know for sure how much, and so that's what we think.
And you can talk about that.
Probably still will.
Is your gasoline, your diesel fuel, is
It's
that?
all the same line item. Other supplies and materials, we're requesting to replace mattresses in half of our stations, $2,800 for that. We're also requesting to replace the recliners in all of our stations for $13,000. It's just time for those to be replaced. Some of them are 14 and 15 years old, and it's become an OSHA problem.
How many are there, Mike?
How many stations?
How many recliners are you talking about?
Some stations have 2 and some have 1.
Total?
I don't remember exactly, but the recliners, I think they're $279 a piece, I believe, was the best. How much?
He brought some pictures, and these are in desperate need of replacement. I mean, they're.
I'm not doubting, I'm just wanting to
Springs
know
are-
what the cost is.
I
I mean,
think
we got
it's-
$13,000 here to replace half of them. Is that 2 or is that 50? I mean,
There's 12 stations, and most of them have 2 recliners.
so that's 24, so half of that'd be 12. So you're talking $1,000 a piece.
Yeah, that's too much money.
Well, then our count's off somewhere then.
Mike, I tell you what I run into, and Commissioner Young can probably verify this. We purchased some, and what we did, we went kind of these medical chairs from they're sturdier, and they've actually lasted longer for us than anything we've had. Don't you agree?
Yes, sir.
And the cost is a little more, but the mechanism stuff's got a lifetime warranty. And, you know, we've called them, and they have, they sent a guy out there, and the parts warranty them, and we've had some pretty good service out of them.
I'll check with y'all then and find out where you get those.
You know, that's something you might want to look at. And I think some of your people have probably seen in some of ours and know what I'm talking about.
Did you say $279 each?
Okay.
Or something?
I didn't say that, he
I
said
think
that.
they were $239 each. We tried to do a deal with the Lazy Boy manufacturer in Dayton, Tennessee, but that didn't work out, and that was still way too high. We had some Lazy Boy recliners that actually lasted longer than any of them, but still, for the price that they were asking, that was just not feasible. So we got the low bid that we got, I believe, was from Quality.
Yeah.
But I'll check with you.
Anytime somebody's, you know, 365 days a year, 7 days a week, you know, when you know, fire departments and EMS, I mean, they,
Need to be made out of steel.
yeah, they're hard on them, and, you know, it's not like having one in your own home, you know, it's,
Mine
Also,
gets used a lot to have. Mine gets used a lot to have.
I think Mr. P made a good point. If it was 24 recliners at $279, that would be $6,700.
yeah, and I believe that's correct.
But you got
But it says
$13,000 is what they're questioning, I guess,
Yeah.
I would,
for recliners.
I'll go back and recheck that, but I do believe that it was less than $500 for the 12 stations, 24. So.
yeah.
At 500 each, it'd be 12,000, but I don't know what it's that much or not.
If you get a $279 recliner, and it's truly a recliner, you're gonna be lucky to get it for a year to last that long.
I'll check with the fire department.
You can spend probably $600 and
Keep going.
and
You can spend a lot.
I think that's about the ballpark, best I can remember. And we've had them the last, what,
3 years.
3 or 4 years right now. So,
But these that he has are probably 5 or 6 years old.
Oh, some of them are 14 years
Or
old.
yeah,
more.
yeah,
The ones in Christiana, I know are 14
Yeah.
years old.
that's when they're still standing.
They're not. Those are the pictures.
Yeah. I mean, but this chair, I mean, $600 is a lot of money, but this chair are built like those chairs that they don't rise up, you know, for medical purposes, but they're made out of the sturdy stuff where someone would be sitting for quite a bit. And
Is it like the chairs that they have in the hospital where the visitors sit in the room?
kind of, yeah.
Got a new- they got a
Kind of.
landing that's in there.
I'll come down and see you.
All right.
Also, in that line item, we're requesting to replace 13 portable radios for $3,250. I don't know if it'll take 13 or it could be more than that. That's just the best guess. We've already had to replace some. They're getting to the age now where they're not doing right, and it's cheaper to buy a new one than it is to fix them sometimes.
Is it? That's altogether not a piece, isn't it?
Pardon me?
Thirty-two
Yeah, that's
fifty.
altogether.
Okay. Well, some radios are that's not even. They wouldn't even buy some portable radios, so that's why I didn't know.
No, this is all. The trustees commission is something that I don't know about, but it's increased.
Because your expected revenues, your collections are going to increase.
I guess that's a good thing.
Yeah.
Communication equipment, we would like to buy 2 new mobile radios to go into the ambulances and motor vehicles as where the 2 ambulances are.
When you get a new ambulance, are you taking 2 out of service?
This time,
Okay. You can't take those radios and move them across?
those radios that are in those older ambulances are not compliant with the new regulations.
You got narrowband problems now.
And health equipment is to purchase 2 new defibrillators and stretchers for those 2 things.
Well, we definitely want a good defibrillator. Okay, so.
I just want to tell you all about what we're faced with on these defibrillators. Physio Control has been who we've purchased defibrillators from for a long time, for I guess ever since we bought defibrillators. They're no longer supporting the LifePak 12, which is the one that we have on the ambulances right now. They're not even going to make parts for them within a few years. And they want us to buy the newest and latest Physio Control, which is about $35,000. We don't want to do that, so we're going to put it out on bid. I suspect that we're going to get bid. The low bid will probably be from Philips. So I think what we'll see is over the next several years, we'll make the transition from using Physio Control LifePak defibrillators to Philips. We've checked that they'll transmit the trouble EKGs.
Well, is that gonna be compatible with what Murfreesboro's got? And I know Murfreesboro, City of Murfreesboro just donated 4 the ones we had to the Rutherford Fire and Rescue, and I guess hopefully that'll be compatible with y'all as well.
They'll all work together, but I just can't hardly see paying that high money for the name that's on there. Philips is a reputable company.
Yeah.
We won't have liability issues with them, and so I think it's just time that we probably thought about making that switch.
Do those units have communications so you can send that directly to the hospital, either unit? Okay, just want to make sure. I felt sure y'all were, but.
That's it.
Any questions for Mike on his budget?
How many new ambulances have we got in here?
2.
And that's which line item, 718?
718.
That's gonna pay for 2.
Are you still buying, are you not buying big chassis ambulances, or are you still buying?
We're gonna buy the ones just like we bought last time.
Okay.
But we're gonna put them out on bid. And one of the things that makes that less money is that up until this point in time, we've included radios in the new ambulances and stretchers and defibrillators. But we're not gonna do that because I think we can do better ourselves.
Yes, when you spec out the loose equipment stuff, you usually get a better price. Any other questions for Mike?
Yeah, you're anticipating in revenue 5.6 million this year. And next year, you're expecting in revenue with the billing service on board the whole time. And you expect what, 6 million, 6.1?
I wrote it down.
No, I didn't write that down, Mike, I'm sorry. Well, they've got to get it at a minimum of a 5% increase.
Mm-hmm. Or we don't pay it, right?
Yeah.
They told me that they thought it would be 12. They said they thought it could be as high as 15.
That'd be good.
So, well, I guess what I'm getting at is with this budget, I don't know what your ending fund balance is off the top.
1.4.
1.4, and what's the minimum on that?
That's the mayor.
We don't have a minimum on the ambulance.
Okay. What I'm getting at is it gonna be able to come without a property tax increase for a half cent or something for you?
I don't think we need any increase. I mean, we've got $1.4
We think we
million. We think we might end the year this time at maybe $1.8 million, so I think we've got enough money in there
With getting
to
more
fund this
from
budget and maybe,
Okay.
and pay for these ambulances, et cetera, we think.
Recliners. I got my wife a recliner a couple years ago at Christmas. I know how much, but I get to use it most of the time.
I think it's gonna be more like $5.79 than $2.79.
All right, any more questions for Mike?
I just, on this recliner issue, this is coming in the budget, so.
I'll have the answer.
You know, check out what he's got and see if that's viable, and then let me know exactly how many there are. Like 15,000, if there's only 12 you're gonna do, you don't need but about $3,600.
I can vouch
Okay.
for, you know, if you spend a little more money on them and buy something that's gonna last, it's gonna save you in the long run.
And I don't have a problem with that, I just question how many there are and, you know,
So you can answer it in budget.
Mr. Nunley, I'm gonna let you know, I'm gonna vote yes for your budget, but I would like to see, a true cost. Fuel and everything for the sort team. I think we need to know what it costs a year to run them. We need the sort team no matter what, no matter how we fund them. I don't like how we're funding them right now. I'm for the sort team. I just want to know X. What does it cost? Because we need to find that. Regardless on whatever, I want to know X.
I'll get that and send it to everybody.
And then maybe also on your report, having what zones they respond to per call, so we can see. So if I got a big goose egg for District 16, I can say, hey, you know what, my citizens aren't benefiting. I think that's only fair to my constituents, but I'm gonna vote yes for your budget, because regardless, we still have to fund them. But I would like to see that kind of separate, so.
Hey, you know, I'm a rural commissioner, and I don't mind voting to fund things to help out the city residents. You know, it goes, I mean, we're elected by districts, but Commissioner Young, but we gotta look at the big picture and to provide services. You know, that's like, I don't have but one school in my district. I would have loved for that new high school that went to Rockville. But I know in the long run, that school at Stewart's Creek is gonna take out of Riverdale, and gonna take out of Blackman, which is an area that I've got. So, you know, we gotta look at the bigger picture.
Commissioner, now you speaking from 16th district. I don't want this sort of team to be looking unfavorable toward the 18th. Because they do respond.
Any of the budgets we've seen today, do they include steps in them?
The step increases for those that are due a step are in these budgets.
Okay.
Anybody else? Have we got a motion on the floor yet? Okay.
I'll make the motion to approve the ambulance services budget.
And is there a second?
I'll second it.
And a second.
And I do want to just throw something out, so,
Okay.
because it's a pretty healthy increase, but what I'm saying is the new billing system, in which they're guaranteeing at least 5%, so that's going to more than pay for the $225,000 that would cost. Of course, they get more if they collect more. But, and then also 2 new ambulances and the defibrillators that go, we're looking at, that's roughly $500,000 of that $600,000 increase. So, I mean, you know, that's quite a bit, you know, and it's something that's needed.
Well, last time we bought them, didn't we get those 2 grants that Christie used?
Those 4
So
that were
that was
used.
one of the reasons that the budget was a bit lower, because it wasn't coming straight out of the county's coffers. So.
Well, we didn't buy any ourselves last year.
How long was that bid for? Was it a year?
It was, remember, we just kind of stumbled across.
That's right. That's
We
right.
found an excellent opportunity.
Yeah, I remember
To get
now.
4 ambulances for $300,000.
Yeah, as soon as I asked the question and you start, it hit me what happened. Okay, anybody else? All right. We got a motion, we got a second on the floor. All in favor of the motion, say aye.
Aye.
All opposed? Motion's unanimous.
Thank you.
Thank you. All right. Yeah, I wrote them out. Fire and rescue.
Two reports.
first page is a rundown of some of the 40 extrications we ran out in the county in the month of February. And we did have a major extrication from Halls Hill Pike yesterday, and one on I-24 today.
What was it? Oh, that's Saturday.
Saturday, excuse me, you're right, it was Saturday. Saturday afternoon. And the average response time has been running about 7.5. And the next page is my report, and one of the things we've been able to do through the county fire department with the assistance of EMS is they have helped us get 7 or 8 certified CPR instructors in the county that are willing to teach not only their department but another department, that we may keep all of our firefighters CPR certified, as CPR and AED certified. So through the assistance of EMS, Mr. Nunley and Steve Hart, we were able to accomplish that.
What's the cost to your firefighters?
Just the cost of the card, which I think is $10. They want a card. If they don't want a card, it doesn't cost them anything. But most of them, like to have a card because they need that for their state fire certification.
Question, and apologize for hoping to catch you or Mayor either one off guard here on this, but just read this here. Met with Mayor Burgess to discuss fire curves in Christiana. I mean, Christiana's part of my area, and I was wondering what.
31st.
Christiana's having some major manpower issues and not being able to have enough people that actually volunteer for their department. And I took measures to inform the mayor that we've asked Station 1, Station 3, and District 35 to assist them in depending on where the call is at in the district, because of such low manpower in the daytime, nighttime, around the clock, that anytime there's a call out in that area, that Fosterville will be automatically paged, or Station 1 from town, or Station 3 out on Manchester Highway, depending on where that call is in the Christiana area, that they will be dispatched automatically to help them.
Okay.
Because they're having major manpower issues right now. And sometimes their chief has gotten on the radio and says, ask for assistance because they had nobody to respond. And I've talked to him about that, and they're trying to build up the membership.
Okay.
But a structure fire, there's automatically 2 other districts called along with Christiana.
Okay.
Because we'll make sure that the area is being maintained.
Well, I've seen that in Christiana's part of the 7th district.
And of course, the next page is the training hours and call volumes. And the next page is the water reports. First department. And then the last page is a rundown sheet of what EMS has given me of what they've spent up to date as of today on all the rescue vehicles. And that's fuel, maintenance, preventive maintenance, and it's giving you a rundown of the mileage on some of the vehicles.
So basically, it's gonna be moving that over in your budget.
Yeah, EMS was kind enough to help us out. We first started this as a kind of partner because we didn't know what it would take to be able to meet these needs, and so they've kind of tracked it for us and give us some idea of what we need to budget for.
Okay. All right, any questions on his report? If there's not any questions, we'll entertain a motion.
Motion to approve.
Second.
Motion and second. All in favor of the motion, say aye. Aye. All opposed, motion has carried. What's that? Oh,
Why keep it on that?
And this is the proposed budget for this coming year. Me and the mayor met today, and along with Lisa Nolan, and I agree with the mayor's recommendation. It's kind of been a learning curve for me this year.
yeah.
It's only employees on here, or
It's me.
or it's yourself. No, there's no secretary, anything like that added in right now.
No, sir.
Make a motion to approve this budget.
But, all right, is there a second?
Second.
A second. All right, the question I got is, where is the, I guess, contracted services?
That is line item 399, top of the second page. And there's 8 departments left, and that's added, gone from 30,000 a year to 35,000.
So that's a $5,000 increase.
They're getting an increase.
But, and that's the reason I was bringing it up. I wanted to, if there wasn't one, I was gonna
Make a recommendation.
make a recommendation for one.
Well, that's 8 departments left, that's not part of the county, and that would give them 35,000.
And the reason I bring that up, and to let some of the rest of the committee know, I mean, especially since a lot of these departments have taken on the extra rescue operations and stuff, and you know, they've stepped up to the plate. They've got people sitting there 24 hours a day, not sitting there, but they're manning the station 24 hours a day, and you know, their electricity costs has went up, their fuel costs has went up, and
Well, their fuel costs ain't gone up because we're covering the fuel for those rescue trucks.
well, okay.
But
There's other costs that has went up, and
When you, 338 maintenance, you requested 75,000 versus 25,000, was that versus the mayor's recommendation of 25? What were you trying to, why is that figure so skewed?
Well, that's just basically my fault. I really didn't know.
I didn't know if you were gonna try to
we
cover
got-
the county's fire trucks too.
No, we got 18 pieces of apparatus, and I just, I really didn't know what to budget for that, and, because, you know, it was the pumps, $15,000, and the
Yeah.
tires and stuff, but
Well, I know-
based on what we spent so far this year, and of course, if there's an issue, we can always revisit it next year, but that's really my fault. I didn't really know what to budget for that.
Well, the reason why I was saying that, and when I was a fire chief, I know we would spend about $10,000 a year just to maintain 2 pieces of equipment. And 25 to me, I think you're gonna have to come back, especially because we haven't replaced anything in the county. We got 20-year-old pumpers and now 11-year-old fire engines, so the maintenance cost is gonna get more and more and more. I just don't see that 25,000 holding for 12 months, from my experience.
Well, based on what we spent, I think it was $7,000 on maintenance on the rescue vehicles, and what we spent, this is a 6 months figure, it was like, it was close to 9, I think. So that's still within what that's still obviously more than what we spent this year, so.
And you may be very well right. It may be that that's not enough money, but if we put the money in there more than that, we got to appropriate for it, so we.
yeah.
If we come back, we come back. I just want,
Right.
that's something that I see as a,
It may be not enough money, I agree with you.
The reason I went ahead and made a motion to approve this is, if you look at the bottom line on that page, we're about $6,500 over what the actual costs were last year, and we've got quite a bit of increased services all the way across the board by having formed this department. That's why.
Well, also, I
went ahead
want to toot the horn a little bit. We got that $400,000 communications grant too, just because we have a county fire department that we wouldn't have been able to apply for. So I'm proud of that fact that the fire department has helped pay its way a little bit.
All right, we got a motion and a second on the floor. Is there any more discussion? If not, all in favor of the motion say aye. Aye. All opposed? Motion carries. It's unanimous. All right. Anything else? Appreciate it. Thank you. OSHA report. I apologize to you, I just realized that you had the report.
That's okay. It all comes around.
You'll be first next time.
Yeah, I apologize on that.
The report this month is pretty much straightforward for the month of January, January being the first month of the calendar year for the OSHA. For the month of January, we had a total of 18 injuries. You'll see the breakdown there. Of those 18, 10 of them were OSHA recordable, and 3 of them had restricted days. We had no lost time injuries in the month of January. Next page kind of shows you where we were compared to the last 2 years, down slightly, but of course, you always remember it's somewhat cyclic, and so it pretty well measures out by the time the end of the year.
You did pretty good on slips, as much ice and snow as we've had.
Well, and when you turn over a little bit more, you're going to see that's where the injuries occurred.
Right.
Out of the 18, there was $27,700 incurred, and when you get over and look at the county, it's 11 of them were in the county, and most of those did come during that time when the schools were out and everything. Unfortunately, the rest of the county was still working, so we had a number of slip, trips, and falls in the county. 11 injuries in the county that incurred $21,600. Board of Education had 7 claims, or 7 injuries, and their total incurred was $6,100. And that's all I have. Like I said, that's pretty much straightforward for the month of January.
Anybody got any questions for Dan?
Motion to approve the report.
Motion approved, our second.
Second.
And before we vote, next time if you would, I apologize to you. Let me know that and I'll get you.
No problem.
That way you can get in and out of here.
I appreciate that. No problem, though. Thank you.
All in favor of the motion say aye. Aye. All opposed, motion carried.
You all have a good evening. Well, you had other things on your mind with the sheriff, and wasn't going to get it here back.
I appreciate it. All right. Any other business come forward the committee?
I've got one for the mayor. On the back of the fire department's budget, what about, where are we at on new pumpers or tankers or whatever they're wanting? I know we just voted for 2 ambulances because we needed to replace stuff.
Yeah.
And I know we need to replace stuff on the other side, especially out for, doesn't affect me, it affects these guys' districts. I want to make sure they're taken care of out there.
Normally, once every 10 years is what we've been doing.
But it's the truth, they need them, and it's been 11 years now, so we need something.
That's an excellent point. It's a point well taken. To be honest with you, we didn't have enough time today to get together on exactly what we thought we should recommend. We'll have to come back with the capital expenditure request and on the pumper/rescue truck and on 1 or 2 other items. So we'll be back on that. So we weren't prepared.
And not to mention, some of those chiefs have called me too, since they know I'm up here, and I wanted to address that for them, so.
It will come back, but we didn't have quite enough time to get our good set of information together that we were comfortable with.
Anybody else? All right. We stand adjourned. Thank y'all.
You're welcome.